Hello everyone, I'm Dr. Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital, Bangalore. October is Breast Cancer Awareness Month, and here I want to bring out the importance of breast cancer screening today. Globally, breast cancer is the most common cancer among women. The recent data also point that there's an increasing incidence of breast cancer amongst the younger population. Also, by screening and detecting breast cancer early, we can have better cure rates, and that is why it is important to be aware of this information. The burden of breast cancer in India leading to death is more because of delay in detection of breast cancer and delay in definitive treatment. Screening for breast cancer or screening for any disease involves detection of cancer before the symptoms develop. So, breast cancer screening is very simple. We need to identify if there are any risk factors in an individual. Therefore, all women at the age of 30 need to get a risk assessment done. The risk assessment involves meeting a gynecologist or meeting an oncologist to identify the risk factors that you have, such as family history, are you carrying certain genes. By identifying these risk factors, we can use specific screening methods to diagnose breast cancer early. Apart from this, all women from the age of 25 need to start doing a self-breast examination. The self-breast examination involves examining your breast, particularly after your periods. You can do it when you're having a shower. Breast examination means you examine your own breasts in a cyclical manner, either from top to bottom or in a circular manner, such that the entire breast is palpated by the tip of your fingers. This has to be done even in lying down position and in sitting position, and also to stand in front of the mirror and lift your arms and see if both the breasts look normal. If there are any abnormal signs, such as any discharge, any lump that you can see, any abnormal changes in the skin. By doing this, you can approach us when you feel there is something abnormal early itself. Apart from breast examination, self-breast examination, I would advise that all women from the age of 40 come for a clinical breast examination by us, that is, by the gynecologist. Also, the guidelines say that all women 40 and above should get a sonomammogram done yearly. Yearly means every single year, keep a month fixed that this is the year I screen myself, this is the month, it could be October, is the month when you screen yourself by a sonomammogram. The reason we say sono is ultrasound also should be included, as the mammogram can miss certain lesions, particularly if your breast is dense. By doing this, we can pick up even microscopic or small breast lesions when they are in stage 1 itself, so that the diagnosis is early and the treatment is done. The success rate, the survival rate is better when it's diagnosed at stage 1 rather than at advanced stages. A very important point I'd like to highlight is if you have a family history of breast cancer, that is your own mother, your sister, your aunt, your grandmother, and especially if they've had breast cancer in their 40s or at a younger age, you need to start screening yourself 10 years prior itself. Supposing your mother had breast cancer at 40, you need to start screening at 30 years itself. Also remember that 75% of people diagnosed with breast cancer do not have a family history of breast cancer. So that is necessarily not a significant point, and all women should screen themselves for breast cancer. Remember that it cannot be prevented, as all of us have breasts, but it can be diagnosed early. So be aware of your body, get a self-examination done, and meet us regularly so that we can reduce the burden of breast cancer in our country.